In this video, I simplify what the new CMS 2027 Notice to Insurers means for Medigap plans and Medicare Advantage plans, and more importantly, what it might mean for your premiums. Coming up next on Holy Schmidt.
Holy Schmidt!
Medicare made the news on Tuesday when the CMS announced that they were holding flat the budget for Medicare Advantage plans. Holding flat means that they're not paying the insurance companies any more than they were paying them in 2026, for the most part. The proposed rates that the CMS provided to insurance companies was a very, very modest increase of 0.09%. Historically, it has been about 5%, so that's 555 times more than 0.09%. And of course, the reaction from the equity market was completely predictable. The insurance companies' stock prices, those that sell Medicare, plunged up to 20% in some cases. In fact, Humana dropped 21%. CVS Health and Elevance both dropped 14%, and United Healthcare dropped 20% on this announcement. And for those of you who don't follow the stock market, a 20% decline in the stock price of any company, particularly a company like United Healthcare, is very rare, and it is a very strong signal that something has gone horribly wrong. And so I read the report, all 168 pages of it. And to begin with, this is not an easy read. 168 pages from the CMS is a lot like reading the dictionary. It was page by page, and it took several hours to get through it. The good news is that I'm going to break it down for you and make it really easy to understand and really talk about three terms because the rest of it just supports the decision, or most of it does anyway. The first is what's called risk scoring, and this is really important if you're on a Medicare Advantage plan. Risk scoring simply means that the government pays insurance companies more if someone is higher risk and likely to have a claim, or more likely to have a claim. This makes sense because whether you like insurance companies or you don't like insurance companies, they do need to stay in business in order to pay claims. So assessing risk is really important. And unlike Medigap, Medicare Advantage plans have a risk score because they get paid basically in advance for claims that may happen in the future. Medigap works the opposite way. The score is based on the diagnoses that are in the insured's files, things like heart disease, diabetes, etc. The more of these diagnoses that are in there, the higher the risk score and the higher the payment to the insurance company. But then there's another term. It's called Diagnostic Testing from Unlinked Chart Review. Now, Diagnostic Testing for Unlinked Chart Review is where things get murky, because what happens is that an insurance company will go back through a patient's file and find additional things wrong based on the data in the file. Now, it's not a doctor who does this usually. It's an analyst, and all they're looking for are risk factors, evidence to raise that risk score. These paper-only diagnoses raise the payment from Medicare to the insurance company, even if the patient is unaware of the diagnosis. The CMS is saying for 2027, these unlinked chart review diagnoses will no longer count for the risk score. The person has to actually have the diagnosis given to them by a doctor, not an analyst combing through the files. This change closes a loophole that allows insurance companies to get paid more even if the patient is unaware of the diagnosis, and this is why the payment to insurance companies for 2027 is expected to decrease significantly. Now, a couple of points here. Because this is brand new, there was a lot of misinformation that was initially reported because, well, they didn't read 168 pages of document. But this is not saying that Medicare Advantage premiums are frozen. The payment to insurance companies from the CMS is capped at 0.09% increase. And it doesn't change insurance law. This number is given by the CMS, by Medicare, every year, and the insurance companies work within the number. And most importantly, it doesn't cut benefits. What it does is it forces insurance companies to provide a diagnosis after a medical examination rather than just through a paper audit of the patient's files. Gang, Medicare can be confusing. Talk to anybody who's 65 years or older and they'll tell you that this is true. Even after hours of research, people still make the wrong decision, costing them hundreds of dollars a year. On this channel, we have 3 affiliate relationships. One is our trusted Medicare partner, Chapter. Chapter is the only national advisor that recommends every plan. They are totally free to you. They save their clients an average of $1,100 per year, and they won't push you into a plan that you don't want. Best of all, they're really easy to work with, and it takes about 20 minutes to have a discussion with them. If you are soon going on Medicare, or you just have questions about Medicare, give them a call at 440-703-1224 to see if they can help. On the surface, this should be a good thing, right? Because it prevents insurance companies from overcharging the government and government waste. So intuitively, it makes sense, and just about every industry goes through this. But does it make sense for the Medicare Advantage system? Well, let's take a look. In 2023, there was a 4.88% increase over 2022. In 2024, there was a 3.32% increase over 2023. And in 2025, there was a 3.7% increase over 2024. And in 2026, the year that we're in now, there was a 5.06% increase over 2025, a very big increase compared to the prior years. And the proposal for 2027, 0.09%. This means that it's unusual. It doesn't mean that the CMS is calling it wrong. In fact, my guess is that they probably have it right, or at least partially right. But it is notable that in prior years, it was 3 to 5%, and now it's 0.09%. But an important question is, why isn't this being done to Medigap plans? Well, the short answer is they don't need to. Medicare Advantage plans are paid in advance, and the payment is based on the risk scoring, meaning how ill someone is on the plan. And each person gets a risk score. The sicker the person looks on paper, the more money the CMS sends to the insurance company. Full stop. Medigap plans work in the opposite way. Medigap insurers collect a premium directly from the beneficiary, pay claims only after Medicare pays first, and reimburse a fixed set of costs like deductibles, coinsurance, and copays. Because of this, there's no risk score. There's no need for a risk score, and there's no diagnosis-based payment. It is pay for service, and that's it. And just to be super clear here, there's no financial advantage to adding additional diagnoses or finding extra issues in someone's chart that they don't know about. So CMS Oversight of Medigap is focused on standardized plan design, meaning Plan G is Plan G everywhere, consumer protections, and rate increases in pricing practices. But CMS doesn't need risk adjustments for Medigap because Medigap insurers aren't being paid more the sicker the person is. Now back to Medicare Advantage policyholders. What happens when a company's revenue options are capped? Well, they try to keep costs down in other ways. This may come in the form of layoffs or adding technology so that they can lay people off. Or in the case of a Medicare Advantage plan, perhaps capping some of the benefits that are being paid out or raising rates. This means that it doesn't affect Medicare's Part A and B benefits, Medigap standardized benefit structure, and the guaranteed issue rules where applicable. Now let's talk about what's unlikely to happen. The first is rate hikes across the board with all Medicare Advantage providers. The second is a change in your 2026 premium because this doesn't go into effect until 2027. And the third is that it's unlikely that there's going to be an immediate benefit cut to Medicare Advantage plans. Medicare Advantage plans reprice annually, not monthly, and so this is a future issue for 2027, and you'll probably hear a lot more about it as we get into the fall. And there's still a lot to do because we are in what's called the comment phase. That means that this document is put out there for people to review, mainly insurance companies and lobbyists working for insurance companies, and they comment on it. And I'm pretty confident that the comments are going to be negative coming from the insurance industry. Undoubtedly, there will be commentary about why this practice isn't unethical or unusual and why the insurance companies need to do this in order to make ends meet. After the comment phase, the CMS will take all of this into consideration and publish their final rate on April 6, 2026 for 2027. If you like this video, check out that video, 1.2 million plans canceled. This is Jeff Schmidt, and I will see you in that video right there.